Thank you so much for the opportunity to spend a few minutes teaching you about something we're very passionate about, and that is body contouring after significant weight loss. This is a long talk, tons of education. We're really trying to give you a great overview of the types of procedures that can be done, what the motivations for these are, some of the risks, the costs, recovery, all the things that patients always ask about. We really want to try to get that out. Going to break this talk up into the first part that really looks at the different types of procedures and shows lots of photos and things like that. And then the second part that will deal a little bit more with recovery and costs and ideal candidates and things like that. So let's get right into it. Let's jump right in. One of the things that is so important about this kind of surgery is the educational part of it. Knowledge really is power here. Every single patient, each one of you has a very different weight loss journey, has different goals, different areas that bother them. And it is very exciting for us and interesting for us and important for us to spend the time with every single patient to understand those goals and motivations to arrive at a plan that is individualized to that patient. When we do that successfully, we have beautiful results, happy patients, and happy surgeons, a win-win for everyone. So what really is body contouring after weight loss? Well, there are really four main goals that apply to almost every patient, and they include removal of excess skin, tightening of remaining skin, filling or refilling an area that's lost fat or volume, and then in many cases, lifting as well. And we can do that surgically and non-surgically, but really for today, we're going to focus on surgery, and we're going to go through most of the different body areas where we can do one or more of these four things. One more thing on your journey and on your goals is our understanding of why you want to do this kind of surgery. And of course, the general perception for this kind of surgery, and for sure plastic surgery in general, is that patients are doing this for cosmetic reasons. But we really understand that that's only one small but important part of this, but really that there is a massive functional component of this type of surgery that allows patients to be more active and move around in a much more comfortable way, and that there is a huge psychological component, and there's very good data, lots of research these days about the incredible psychological benefit of body contouring after a patient has lost a significant amount of weight. And so this is a lot of what we'll talk about during the consultation, really these goals and motivations. So let's get right into the options. There really is truly a world of possibilities, but I'm going to try to go through some of the most common options. We're going to start with the abdominal or trunk area. As with everywhere in the body, there are so many different presentations, from varying laxity to issues with hygiene, to extra fat that remains that we can't get rid of. Lots of different presentations. You see a few examples on the slide here. The goals, as you're going to hear over and over, are to remove the excess skin, to contour the remaining skin, and to repair the muscles. And repair the muscles here, very, very important. This is where the functional component really comes in. You can see on the left cartoon of the muscles where they're spread out that there's a real distortion of the anatomic position of those muscles because of the extra fat that was pushing those muscles out. This also happens in pregnancy in a very similar way. And so our job first in this type of surgery is to repair those muscles, put them back into the midline where they properly support the back, the spine, and where there's a tremendous improvement in comfort. So depending on the degree of skin laxity and your individual shape, you can have a beautiful result with a standard abdominoplasty, a fleur-de-lis abdominoplasty, or a body lift. Three different ways to do this. You can see that in the cartoons here, there are three different scar patterns, and I'm going to go through each of those. The one that you're probably most familiar with is the standard abdominoplasty. This procedure does an excellent job of addressing the lower front of the abdomen. It leaves a small, well-hidden scar and can do a great job in a patient just like this. This is not most of our patients that have lost a lot of weight, but it is some patients that have this appearance and do very, very well with a standard abdominoplasty. So if the problem is in the lower front of the tummy, this is a great procedure for that. The fleur-de-lis is a modification that adds a vertical scar, so a scar down the midline of the abdomen. This is admittedly a visible scar, and we don't love that extra scar, but the power to remove extra skin from the upper abdomen in that vertical dimension is really truly powerful, and you can see that here in the photo where we can remove skin in both the horizontal and vertical direction to achieve an excellent shape to the entire front of the tummy. So it really is the best overall procedure if the problem is the entire front of the abdominal area. And finally, the lower body lift is really a completely different type of procedure. This comes with a circumferential scar, so a scar that goes all the way around the body at the level of the waist, kind of like removing a donut. And it provides the same benefits for the front, tightening and flattening, removing the extra skin from the front of the tummy. But when it comes around to the side, we're really focused on lifting up the thighs. And when we get around to the back, we're focused on lifting up the buttock. And you can really see what an impact that makes in this photo, both to the front, the sides, and the back. That's the body lift. Let's move onto the breast area. So completely different here, but an area that bothers a lot of our patients. A wide range of presentations after weight loss, but most often including some degree of ptosis or droopiness of the skin, breast volume deflation or loss of volume, and oftentimes this extends, or the extra skin extends out onto the lateral chest, the side of the chest. So we're going to talk about options for all of that. The goals, as you can guess by now, are to lift, fill, and often to lift and fill. So let's talk about two ways that we do that, since lift and fill is the most common. The first is with what we call a natural implant. And really that's where we use your own extra tissue, some of the tissue that you don't need. Let's say it's at the lower part of the breast, the droopy area, or it's even on the side of the chest. We can contour that tissue and place it within the breast to add back the volume that has been lost with the weight loss. And so that's like a natural implant. And then we, of course, lift everything around that. And so we get a lift and fill. The second often used way to lift and fill is with a silicone gel implant. And so again, we will remove any extra skin. We will tighten and shape the rest of the breast, and then we'll place an implant to actually give us the volume. Okay, let's move on to the arms. This is, again, very different. This is an area that traditionally was done last after the tummy and the breasts have been looked after, but actually in recent times, so many of our patients are coming to us first with concerns about their arms, really just wanting to be able to wear short sleeve t-shirts and tank tops and really just be much more comfortable in clothes. And so many times we're starting with the arms these days. When we talk about the arms, again, many different presentations, and we're going to break it down really into the upper arm itself, the extra skin and sometimes fat in the upper arm, as well as the extra skin or fat that extends to the side of the chest or the lateral chest, so-called bra roll. Sometimes it goes all the way around to the back. So these are areas that we often will look after all together in the same procedure. The goals: remove the residual fat, lift the skin, tighten the remaining skin, and contour everything around the arm so that everything looks natural and symmetric. So let's look at the two types of brachioplasty or arm lift that I just mentioned. The first is the standard brachioplasty that really addresses the upper arm. You can see the scar runs along the groove of the biceps, and it heals very nicely, but it is a visible scar, and it can do a tremendous job of contouring the upper arm, as you see in this photo. The extended brachioplasty does the same thing for the upper arm, but continues down the lateral chest or the side of the chest, where you see here there is extra skin and fat, and sometimes it's a lot more of this on the side of the breast. And so we continue the scar down and we remove not only the extra skin and fat of the upper arm, but also the lateral chest. That's a very powerful procedure, very often combined with a breast procedure, because you can imagine it just sort of follows along from the arm to the chest to the breast. Here's from the back, also very powerful from the back, the same incision, but I'm just showing you what the standard brachioplasty looks, how it can contour the upper arm, what that looks like from the back. And then the extended brachioplasty, you really see not just, of course, the huge change that we see to the arms, but you see that this extra skin and fat on the side of the chest and even the back is really brought forward and tightened with that extended brachioplasty. Okay, we're moving on to the thighs. Okay, and that really is the last place that patients usually turn to. It's an area that a lot of our patients can uh, deal with temporarily with Spanx and tight pants and things like that for comfort, but eventually becomes an area that in many patients just drives them crazy. Like the other areas, the goal is the same: to remove the residual fat, to lift the droopy areas, to tighten the remaining skin, and then to contour around to make sure that everything looks nice and natural. And like everywhere else in weight loss patients, there's a wide variety of presentations. So you can see just in these two photos, these are two different patients. The one on the left has a minor or a small amount of skin laxity in the medial or inner part of the thigh, and the patient on the right has a significant amount of excess skin and fat distributed all around the thigh. So let's see what these patients look like after. So at the top left, you see the patient with the extra skin in the inner thigh. We can put an incision down the inner thigh and remove that, contour the rest of the thigh, and she has a beautiful result, very comfortable for her with a reasonably well hidden scar. And then the more severe case in the lower left has a longer scar that goes from the groin right down to the knee, but it's in the inner thigh. So eventually, when it heals nicely, pretty well hidden. But that is very powerful in recontouring the entire thigh. And of course, we combine that with some liposuction contouring, and she can be much, much more comfortable. I put this photo up on the right because we oftentimes will combine the thigh lift with a lower back lift, and that is incredibly powerful in contouring the thigh, but also lifting the thigh on the sides and lifting the buttock. And that whole area together can make a tremendous difference cosmetically, but really functionally in terms of how comfortable patients can be, how easy it is to fit into different types of clothing. And so I wanted to show that photo here on the right side. Finally, the face, which is talked about separately. It's the one area that we generally don't combine with other areas, although occasionally we do. It is a very, very important part of the body to look after in patients that have lost a lot of weight. It's a part of the body that we can't hide, and we see it all the time in person, and we see it on Zoom and virtual meetings, etc. So we spend a lot of time talking about the face. And just to talk about specific issues around the face, when we do lose weight, we lose fat. Fat from the face is actually important in supporting the skin and the muscles of the face. And so when we lose that fat, not only do we get a little bit more of a hollowed out appearance, but we also lose the support of the skin, which tends to droop and give us the jowling along the jawline here and the so-called turkey neck or extra skin of the neck. And so again, as you can imagine, the goals of this type of surgery to lift, to refill some of the fat that was lost. Oftentimes it's both of those things. And then we also spend a lot of time talking about and trying to address skin quality, which is often affected with significant weight loss. And there are lots of ways that we can address skin quality.